Hi, it's Dr. Smith from Wigston Central Surgery with another video helping us to work well together to provide you with the best care that we can. Now today's video I've simply called Winter is Coming because I want to talk about the demands on general practice at the moment and the ways that you can help yourself and how we can help you this coming winter. Now it's all over the news, the fact that GPs are very busy at the moment, and I'm sure if you've tried to contact us recently, you might have found that to be the case. But to try and put that into some kind of context, I want to just give you a few numbers. You see, the NHS look at how big your general practice is, how many patients you have, and they give you a target number of patient contacts that you should make in a week. And we look at that number and we want to try and make sure that we are offering enough appointments to reach that. In fact, over this summer, the number of appointments that we've been offering has been the amount the NHS have told us to, and half again, over 1,500 appointments every single week. And so that's a huge amount of workload for us to be working through as our doctors, our nurses, our clinical pharmacists. And we're really keen that as the winter is coming and things might get busier still, then we can work well together to continue to provide you a really helpful general practice service. The first thing you can do over the winter months is to look after yourself and look after each other. Respiratory conditions in particular spread a lot more quickly in the winter months. Of course, we've talked about COVID a lot over the last few years, but flu will spread a lot more over the winter months, as will pneumonia and other respiratory illnesses. So it's really important that when you come to the GP, you can be confident that you aren't going to be coming into contact with lots of illnesses that might make you more unwell before you came. To that end, it's really important that if you are positive for COVID, that you tell us that when you ring up. And what we'll do is we'll actually speak to you on the phone first. Now, we're not trying to avoid face-to-face consultations with you, but we're wanting to make sure that they're essential. We have a special room in the building to see patients in if they are COVID positive, because we don't want to put our other patients at increased risk. Now, I'm currently sat in an empty waiting room, but tomorrow this will be completely full of people having vaccinations against COVID, flu and pneumonia too. So if you're eligible for these vaccinations, one of the great ways that you can look after yourself this winter is to make sure you get those vaccinations. So look after yourself this winter by getting vaccinated, and look after each other by trying to make sure that you're not spreading potentially harmful conditions if you do have them. The other thing that you can try and do is to use GP services really well. As you may well be aware, in the mornings we run an urgent morning surgery that's designed for you to ring up on the day and to get urgent appointments that you need. And in the afternoon we have a number of routine slots available to you. It's really important that we try and use these slots in the right way, but if you have a routine problem, try not to use the morning clinic for that, instead booking in for a routine one in the afternoon, even if it means having to wait for a few weeks. We appreciate this can be difficult with work constraints, family constraints, all the other things, but ultimately your health's really important and we want to be able to provide a service that works really well. So urgent things in the morning, routine things in the afternoon. And we're very aware that a lot of appointments get generated by us. We might ask you to come back following a blood result or something else. And we're trying to get better at our communication to you so you know whether you need to come back urgently or whether a routine appointment will suffice. Another way that we can work well together over the winter months is to make the most of all the services that are available to you. So if you ring up and we ask you instead to go to the pharmacy, it's because we feel that they are best placed to provide you with the care that you need. I've spoken in a previous video about the different things that the pharmacy can help with, and it may be that we signpost you to other practitioners such as a mental health practitioner or a physiotherapist if we think they're best placed to be able to provide you with the care that you need. Bear in mind that we're trying to deliver a service here that can meet the demands of a huge number of patients, and so sometimes that does require us reaching out to our colleagues and those around us who are also able to provide you with excellent care. So there's a few thoughts there about the winter months. The winter is coming, we don't need to be scared about that, but we need to be realistic. We need to realise that the NHS is under a lot of pressure and a lot of strain. We want to keep providing you with a really helpful service that can meet your needs, especially if you need to see someone on the day. So let's work together to use that service really well. Take care.